Now, let's move on to the panel discussion. And joining us for the panel are Melissa Institute Scientific Board Member, Dr. Leena Augimeri, Honorary Melissa Institute Honorary Board Member, Dr. Judy Schaechter, and Melissa Institute Founding Scientific Director and Board Member, Dr. Don Meichenbaum. Let me say a couple of words about each of these folks. And Dr. Leena Augimeri is the director of the SNAP program, director of SNAP, Program Scaling and Strategic Partnerships at the Child Development Institute in Toronto, where she oversees research, evaluation, and implementation of evidence-based child mental health and crime prevention programs, including the renowned SNAP, Stop Now and Plan program. Dr. Augimeri co-founded the SNAP model, which is recognized globally for effectively managing antisocial behavior in children under 12. She also co-developed related programs utilizing digital apps and has been instrumental in creating assessment tools and protocols that consider gender and culture. Her extensive work leading to the first police community referral protocol in Canada for young children in conflict with the law and sharing the Ontario government's Youth Justice Task Force. Her contributions to the field have earned her several prestigious awards and recognitions, including the CAMH, which I imagine is some Canadian, but short for Canadian. I should have looked for it, but maybe Leena can let us later. Difference makers of 150 leading Canadians for mental health. Under her leadership, SNAP expanded to 160 communities across Canada, demonstrating significant social impact and potential savings in criminal justice and mental health costs. Dr. Judy Schaechter is an old friend of the Institute, is a physician executive with extensive experience in policy, strategy, and program development across academia, healthcare, government, and nonprofit sectors. Currently, she's the Chief Medical Officer of MedNet Pro. She's enhancing international health services access via telehealth and network improvements. Previously, as President and CEO of the American Board of Pediatrics, she advanced child health outcomes through excellence in professional certification and continuous learning. Dr. Schaechter also served as a health policy fellow with the U.S. Senate, contributing to key legislative initiatives like the COVID response and the American Rescue Plan. She has held leadership roles at the University of Miami and Jackson Memorial Health System, managing large teams and advocating for comprehensive health services, particularly in injury prevention and health equity. Dr. Schaechter's educational background includes degrees from Brown University, Stanford School of Medicine, University of Miami School of Business, and Harvard Kennedy School with a focus on public health, maternal, child health, and environmental social determinants. And Don, only thing I would say that you might not remember is, other than being the founding, one of the co-founders and founding scientific director of the Institute, is, as you know, one of the 10 most cited psychologists of the 20th century, a legend in our neighborhood and in many parts of the world.
That's fine. That's fine.
That's all right.
Here's on. Let's go to my colleagues. Leena,
all right. So
Judy.
let's go.
Yeah.
Good. All right. Now I'll leave it up to you guys to start the discussion. And
Leena, you want to start us off?
Sure. Well, welcome everybody, and thank you very much for having me, and really honored to be part of the scientific committee for the Melissa Institute, and really want to thank the Atman family and Dawn and Etiony for having me with part of your team. Jaclyn, I loved your presentation. I loved what you had to share. I thought, the calls to action, really, the importance of, thinking about threat assessment and working together. I think working together is really critical. The access to weapons is a big one, and not only guns, but knives. we're seeing that as a big threat these days too. And then I think the piece on prevention, and I would like to focus a little bit on the prevention piece. But working together, just getting back to that, is I really liked what you said about breaking down the silos. We have to think about systems and cross systems and how do we all work together. And I also heard in the previous presentation by Wayne Rollins and Reverend Charles Dickens that we have to stop competing against each other, right? We have to really learn to work together. And then the safety plan. And I really liked what you said is, you know, how do we do this? Is it muscle memory? How do we do it from a trauma-informed manner, which I think is so important. But we do know that brain development, you know, our kids learning from that, I call it the lizard brain versus the wizard brain. And, you know, are they able to get up there and be able to think about how to respond? Like you said, the girl who helped her grandfather, right? I think those are really critical pieces. I also loved what you said about assessing, which is assessing and adjusting. It's like anything, when you do something and introduce something, you have to assess it. You know, Dr. Alex Picaro, who was the opening keynote, talks about data. Data is so critical. We're only as good as our data, and then adjusting it based on what the data says. And then really about what I really like too is the practice with fidelity, right? That's really critical, and holding everybody accountable. I think those are really critical pieces that I really heard in what you said. But what I'd like to talk a little bit about is really about the issue of prevention. And, you know, as I wrote copious notes all day today from 9 o'clock in the morning, and from Alex talking about that we need to, you know, he talks about being smarter on crime, right? And it's about people and places, and how do we do that? Which I think is really important. And, you know, as I was listening, you know, the key words were like crime prevention and early intervention and evidence-based strategies and practices. And my statement is good enough is no longer enough. I've been saying that forever. I've been saying that since the pandemic. And we heard loud and clear that a lot of these situations are preventable. And I, you know, and then I look at the kids who, and my 40 years of working in the field has been with children under 12 in trouble with the law. And I'm chairing a youth justice task force right now, and I'm going into youth justice facilities, and I'm talking to kids as young as 12 who committed murder. Kids who are on the street at the age of 13 addicted to meth, right? So we have to do better. We have to think about how do we do better for our most vulnerable kids. And so I think, you know, one of my colleagues from the Cayman Islands talks about the perfect storm. The perfect storm, that these kids are in the perfect storm with everything flying at them, whether it's they're stressed or anxiety, or they're experiencing abuse or neglect or trauma. There's so many things, racism, all kinds of things that are flying at our kids. So we need to think, and Alex talked about this morning, when he talked about some evidence-based strategies, like how do we help kids improve their emotion regulation and their self-control, and how do they handle things? And I think we have to do better in those things. And the work that I've been focusing on for the last 40 years, as Dawn has alluded to, is teaching kids how to stop and think before they act and make better choices in the moment. And it sounds simple, it's not simple, it's not easy, but at the same time it is. And so we need to think about how do we do that and do that better, and how do we ensure that it's from a culturally responsive and relevant lens, because we also heard about that today. And so really it's about also how do we assess. So you talked about threat assessment. So threat assessment is this school at risk of a threat? And then once you identify, one of the things we have done working with those involved in threat assessment is if there are kids who you are concerned about, there are really good assessment devices, structured professional judgment assessment tools. For elementary school, there's the Early Assessment Risk List. That's in its 3rd reiteration. We just launched that one. There is for adolescents or more teenage age, there's the SAVRI and there's the START AV. And then there's also a new tool called the SAPROF that looks at risk from a protective lens. So we have to do better at thinking about, you said, like, A lot of these kids came in. Nobody questioned them. They talked about it, but nobody did anything. We heard in the Florida shooting, since he was in middle school, and I could hear her voice in there. Since he was in middle school, it was no surprise to anyone who knew him to hear that he was the shooter. Nobody did anything. So I'm going to stop there because I'd love to hear from Judy and I'd love to hear from Dawn and Etiony, but these are the things that I think we have we have to do better. We have to do better for our kids and our communities. So I'm just going to stop there for a bit and I'll get in later, I guess.
Go ahead, Judy.
Thanks, Jaclyn. Thank you so much. I think if we were in person, you would have heard an amazing round of applause. You laid that out so well and your life's work, not just the presentation, but your life's work of trying to put a research lens in an area that has the gaps or abysses, right? I mean, we need this very, very much. And you've laid it out logically and in a compelling manner. So I thank you for that. I may echo some of what Leena has said, at least in terms of themes, because prevention was key for me. And when you speak about the importance of the drills, and you use certain terms, I'll use the terms drills for skills. I just want to emphasize a little bit, because you gave the three arguments that kind of go against this. And that third argument about harm to children, where you shared that the research isn't there yet. I think some of us who have those concerns agree completely. And it saddens us that we also agree with you that we need to teach skills through drills, right? That we're on the same page. I just want to emphasize it in terms of the trauma-informed approach, because we have to recognize that whether we have research to say this is already causing trauma to kids, the way it's being done in many places with it's realistic, they don't know it's a drill, they're, a trusted person like a principal comes on the announcing to say we have an active shooter. There's a whole lot of research to other assaults that would say that's going to cause distress in some, trauma in some, and re-traumatization in others. So we want to be really careful and be in lockstep on that. And I think we are. I just think we need to emphasize that to people so that the places that aren't doing it in a trauma-informed way get there. And the other is, and I thank you for starting with how important prevention is. That is, and I'm not putting all this, I think we need an army of people like you, Jaclyn, that are doing, and pardon the military allegory there, but that are doing work so we get to the prevention up front. So Leena just mentioned, what you said, the warning signs are there. People have communicated this, and yet it doesn't come forward. Maybe just 2 weeks ago, I was with a very smart group of 20-something public health students who presented, hypothetically with you have somebody who that could harm someone else or themselves and has a gun, what do you do? And so many of them, to a person really, I don't know. I don't think I have the power to know what to do. Where would I go? Maybe I'd ask somebody else. But those warning signs we can teach, and we can teach upstanders. We know that very well from the work of the Melissa Institute and others around bullying. And while it will be hard, that's the culture change you're talking about at the end, right? That's the, in my lifetime, it's a huge leap that we got to friends don't let friends drive drunk. And we have to get to friends don't let friends bring guns into school, bring bullets into school, shoot up schools. So I believe we can do that. And the reason I want to emphasize it is I think what you're talking about, again, necessary, have to do, teaches good things. But it's human nature for us to seek one solution. And our lawmakers do that almost better than anybody else. So when people, whether it's in schools or those who have the funding, decide, let's pay for the drills, and we don't do the research on the upfront, and we're not funding the upfront, and we're not teaching those things, I fear for our current and future states.
Can I just make a quick comment? I appreciate that point so much. One of the things that I have been, kind of battling is I keep getting told, well, drills aren't preventing shootings. And I'm like, that's cool. Chocolate's not actually helping me lose weight either. It's not doing what it's not meant to do, right? Drills were designed to protect you if something does happen. They're not meant to prevent it. Those are two separate issues that we have to address equitably and at the same time. So I appreciate you both saying that.
If I may, I have two quick observations and one question for you. I thought it was a terrific presentation. The observation is that everyone should go to the Melissa Institute website to see the video that Leena made of her SNAP, Stop Now and Plan. And she has data that it not only improves emotional regulation, but also when given an MRI, that they affected the neurological functioning of the brain. And you should read that. The second comment I'd like to make is that after an accident, airplane, car, what have you, we go for the black box. It's the first thing people go for. And I would like to propose that we need a black box after school shootings. We have a lot of information that has been presented today that characterizes what are the high-risk factors of the perpetrator and also what is all the acts that they go through. What we don't have is any kind of analysis of what the schools have done. Like, do they have a parent outreach program? Okay, beforehand. Has this child been identified beforehand? Have there been mental health services for that? Does the school have a peer warning system? Do they have an anti-bullying program? How early was this young man identified with and how much was they referred to? How often did they see the principal? That is, no school is going to collect this kind of data because it's too accountable, and lawyers will have a field day in suing the school board. But if the Secret Service analyzed this across all schools and then wrote a report without naming a particular school, then we could find out a black box about the ecological assessment. Okay, that's my fantasy. And that would be in terms of any mass shooting. And I've written about that, so is the Melissa Institute. Last thing I want to ask Jaclyn is, what do you think about arming all teachers? Giving all teachers a gun? Is that a wise way that we should proceed? And what are the dangers therein?
Well, you're not trying to put me in the hot seat at all there, Dawn, now, are you? I will say this. We do not have any data to suggest that arming teachers would in any way be an effective solution. There's basically no shootings in schools that have been stopped or prevented by an armed teacher. What we do have available data on, and my colleague Hunter Martindale at the Alert Center, which Alert, if you're not familiar with it, is based at Texas State, and it is the national standard of active shooter training for law enforcement. We have done several studies about perceptions of law enforcement about armed teacher policies, and there's a larger body of literature, albeit not very large. But one of the things that we looked at is, in the absence of any research about the effectiveness of civilians using firearms in active shooter situations, is what does it look like when law enforcement uses a gun, period. And the hit rates of officers, so hit rates refer to how many times does an officer fire their gun and hit what they're intending to hit. In real world situations, when there's nobody firing back at them, it's between 23 and 54% of the time. And when you're firing back at them, it drops to about 18%. And that's people who undergo very consistent, regular firearms training, requalification, recertification, all the things to ensure that they can fire their weapons effectively. And there's a case example that I often point to because it just always has stood out in my head as like, this is a bad idea. But back in 2012, there was a shooting, and it wasn't a mass shooting, but it was just a shooting at street level at the Empire State Building. And police responded. And of course, if you think about Manhattan, these streets are incredibly busy. And you're in a tourist area. And so police respond and they shoot and kill the bystander, or sorry, they shoot and kill the perpetrator. And they also shot 9 bystanders in the process of shooting this perpetrator. And, you think about schools, and they obviously have a lot of similar but different environmental challenges with, bullets can ricochet off lockers and walls and all the things. And all of that is to say that it's kind of inconceivable to think that teachers would somehow be more effective at firing their weapons than a law enforcement officer or any civilian for that matter. So I think, as with anything else, I think it's important to follow what the evidence says. There have been other situations where teachers as well as students have been able to subdue a shooter with just tackling them or talking them off the ledge kind of thing. But we have not seen any cases where an armed teacher has been a success.
Thank you. I must confess that I've been to 28 of these annual conferences. And I need to thank Etiony for putting together this unbelievable conference today. I think of all the conferences we've had over the course of time, the number of dynamic speakers, including those of my colleagues today, are just unbelievable. So Etiony, you deserve much kudos.
Thank you, Don. It's a lot I've been learning from you. So I want to bring this to a closure to honor our commitments to the time, to the presenter. Jaclyn, thank you very much for making time of your busy schedule, and it's been a pleasure having you with us. And thank you for the rest of the panelists for joining us today. This is the most high-power group of women plus Don in this session. I don't want people to not notice that. Anyhow, thank you very much.